He was saying how he could just tell I was not only a lot happier, he could also tell that I was really enjoying my job. And he could tell because I would tell these really exciting stories of patients and people that I was able to help. It was, one, incredibly impactful for the longevity and the health of our relationship.
Yeah, people are shocked that I've got 2 little kids at home. My job, and you talk to anybody, I'm all smiles when I come in here. I'm in a place in my life where I'm motivated, 2 little ones at home that keep me active. I'm trying to be active. I'm trying to
Yeah, I feel like I was definitely, at work I was definitely more rushed. I could spend more time with my patients now. Now, instead of seeing 18 patients a day, I work 4 10s, so I can see up to 10 patients a day.
Yeah, definitely. I feel like I have a lot more personal time. I have more time to really focus on my other personal stuff.
Plan on being here, so I'm trying to also make sure that Pro+Kinetix and where I'm at is somewhere is going to be appropriate for me to retire.
Worked in a insurance-based practice. I was seeing 2 patients an hour. Was a lot.
I got into physical therapy to connect with my patients. Seeing 15 to 18 patients a day made it very difficult to connect to those patient stories or even interact with those patients in between sessions via emails, or just encourage them on the next race or whatever they're going to be doing.
Right? PTs only get like 15 to 20 minutes with their patients. Their patients is who they are or like what they're capable of because they're just restricted by the system that they're in. Getting to work with this patient, identifying the root cause of her pain and her symptoms.
There's definitely a lot of reasons, but if I had to tell you three big reasons why, it's because their vision and their values really align with my vision and values when it comes to patient care with each patient also, and then with no insurance restriction or third parties.
I ultimately was really frustrated by my lack of ability to produce outcomes for people. Wanted to get into sport, athleticism, or just really work on their overall wellness and longevity for the long term.
I had always been drawn to the cash-based model because of the freedom you get to work with like the patients that you want to work with, and work with patients who are motivated.
They really value my expertise, just kind of like a teacher and a student, and me dictating the rest of their life. I think that level of collaboration really helps them embed these long-term outcomes.
Just getting to treat the person as a whole has really made practicing physical therapy a lot more fulfilling.
I think from the mentorship perspective, what's probably the most applicable, and I would say this is true across whether or not I'm talking with patients or I'm talking with current staff members or even prospective applicants or clinicians that want to come aboard here.
Emma, who is our clinic director, shout out Emma, she's pretty much like what I want to be in terms of like pelvic floor and performance stuff. So she has been giving me a lot of mentorship around those things, and she's always willing to offer advice, whether it be clinical, social, personal, and she has really been great in terms of support in that way.
Here we spend at least an hour a month doing some sort of continuing education.
I think one of the things that I'm able to get that I would not be able to get anywhere else are the really spectacular outcomes for patients, and that includes the long-term partnerships with them. I think outside of the patient care realm, what I'm able to get at Pro+Kinetix is an opportunity to grow.
I definitely would agree with that. We do have meetings every month, quarterly, where we talk about goals, where we want to go. The team is always looking forward to continue growing from a clinician and professional standpoint.
This job has also provided me with some insight into what growth as a clinician can look like, financial growth as well. I've gotten a lot of guidance from leadership with that too.